Mental illness and substance use disorders continue to tear apart and have adverse effects on our families, neighborhoods, communities, and the broader society.
Mike Schaefer knows that all too well. He lost his 27-year-old son, Brian, to an accidental drug overdose just 8 months ago.
He struggled with paranoid schizophrenia for all 5 years that he lived after his graduation from the University of Notre Dame, and in hindsight, probably for his last couple of years in college. His mother and brothers and I struggled right along with him. So I know too well the feeling of, surely this isn't happening, as your loved one's behavior becomes inexplicably more and more bizarre and embarrassing. And the growing horror of realizing that your loved one is slipping away from you right in front of your eyes, and you don't know what to do or where to turn. The mental health resources are in short supply, and the stigma associated with mental illness makes it very hard to talk about. You frequently feel like you are all alone in a nightmare. This is why this hospital is so critically important for Northern Kentucky. First and foremost, it will give people a place to go for help.
Sun Behavioral is a 197-bed comprehensive specialty hospital. It's designed to expand and improve integrated inpatient behavioral health services.
It's rewarding to see this community-wide solution become a reality. With Sun, we will be able to better address the need for enhanced access to inpatient behavioral health and chemical dependency resources for children, adolescents, and adults in Northern Kentucky.
Thank you to St. Elizabeth and to Sun Behavioral Health for partnering on this very, very important issue. It's critical that we address and are committed to solving these truly unmet needs in our community.
The Woodbury Corporation actually developed and owns the complex.
A great opportunity to do something, provide resources and physical facilities that may actually improve the lives of others and do a social good.
This building is symbolic of the collaborative partnership between a number of agencies here in Northern Kentucky. It's a collaborative with a shared vision for behavioral health services for the community.
It's very important that there be collaboration between the public and private sectors, because the fact of the matter is we can't succeed without you. Everyone in this room, everybody associated with this facility, everybody that has a job outside this facility, it's important that we have that strong collaboration to succeed, to make the Commonwealth the best version of itself.
So this is a big day for Northern Kentucky, for the community, and I say that not only as a representative of the Governor's Office and as from the Commonwealth, but as a Northern Kentucky resident myself. There's a tremendous need here in the state and particularly in this area for that gap, for those people who have those disorders that relate to substance abuse and mental health, and ensuring that we can ensure that continuity of care throughout the process. So,
thank you all for welcoming Sun Behavioral Health to the Northern Kentucky community. It's really an amazing day, and when I think about how far we've come to get to this day, it really excites me around what the potential is for this facility.